Having a miscarriage is one of the most terrifying things that can happen to any woman trying to get pregnant. And in this video, I'll be telling you what you can do to completely prevent a miscarriage. Even if you have suffered with recurrent multiple miscarriages, or you have not suffered from a miscarriage, but you just want to prevent it. So keep watching. Hi, I'm Dr. Disha MD. I'm your holistic gynecologist and natural fertility expert, and welcome to True Healing. This is your channel dedicated to help you believe in your fertility and feminine power. I am here to help you empower your body naturally to create the healthiest possible baby of your dreams. If you want to talk with me, then click the link in the description below to schedule a virtual consultation with me. So when it comes to treating miscarriages, the first and most important thing is to understand why a miscarriage actually happens. There's a lot of different reasons why miscarriages can happen, and I have broken it into several main categories on why it happens. So the first one is anatomical abnormality, and this is when there is something physically wrong in your reproductive organs, and in this case you can have an abnormal shaped uterus. Sometimes it looks like a heart, or it can be completely septated. And I have seen several patients like this, unfortunately. Or sometimes you can have what's called an incompetent cervix. When the cervix is not able to hold on to the baby, it's loose. Or maybe you can have large uterine fibroids inside the uterus that can prevent the embryo from growing. And sometimes you can also have a severe Asherman syndrome. So those are some really extreme reasons why miscarriages can happen. The second cause of miscarriage can be genetics. You know, obviously, that some things run in families, the bloodlines. Whether we like it or not, there is stuff that can be passed on to us from parents, grandparents, and if they have had recurrent miscarriages, that gets passed down to us as well. Another reason of more genetic causes is that women and men, as they age, the chances of miscarriages increase due to genetic abnormality that starts to happen due to cellular degeneration. And these days, unfortunately, we are aging prematurely and we are having more and more of these genetic reasons. Now, I don't want to sound like with all these cases, there is nothing which can be done. Although it sounds a little extreme, there are things which can be done with all of these things, some more than the others. Especially with the science of epigenetics, we now know that you are not a victim to your genes. And even genetic expression can be changed. You can switch on the good genes and you can switch off the bad ones. The third very common cause of miscarriage is blood clotting abnormality. And this is a really common one these days. In fact, actually, the next ones I'm going to tell you, including blood clotting, are probably the more common ones that I see in my practice. So, blood clotting issue is a big one. And good news is that certainly there are things can be done to prevent miscarriages caused by blood clotting abnormality. And I have had a lot of success stories on my website with APLA, MTHFR gene mutation, etc. Number 4 common cause of miscarriages is autoimmune based issues or immunocompromised patients. Very close to my heart as I have personally been there. And what happens in autoimmune issues is the baby, when it starts to implant, the body sees it as a foreign object. And just like any other foreign object, the body tries to push it away. So there's a very delicate balance that needs to happen to reject a foreign body and accept the fetus. And when we have got an autoimmune issue, then this balance can get compromised, and this process makes it more difficult for the embryo to implant in case of autoimmunity. Fifth common cause of miscarriage is hormone imbalances. So there can be things like you may be deficient in pregnancy hormone progesterone, means you have low progesterone maybe. Or high prolactin and thyroid hormone imbalances are also very common causes of miscarriage, especially in first trimester. And then number 6, and this is a bit complicated one, but that you actually have a lot of control over personally, and the cause is environmental factors. So if you're exposed to chemicals, high exposure to drugs, exposure to x-rays, and maybe even excessive use of alcohol, caffeine, or smoking. Now, these are all the reasons why environment or world around us can contribute to miscarriages. So now, what do we do when you know all this information? Well, once you know what are the main reasons for miscarriage, the most important thing is to do is to test. Test, don't guess. So with each one of these variables, there can be some lab tests that we can do. Some of them are visual, when you're trying to see what's going on inside the uterus itself, or others can be hormone based, or maybe blood test related to, we are checking for different variables like your immune system, your hormones, your blood clotting, etc. We could even do some deeper testing when it comes to chemical exposure or heavy metals, or things of that nature as well. And some of it is just reassessing your lifestyle to understand what you are doing that could be impacting this process as well. So the second step is to do a test or evaluate or look deeper into the potential causes that could be impacting it. Now, once you know what's causing your miscarriage, you have done your test, you have done your analysis, you have evaluated your health, your lifestyle, hopefully with the help and guidance of a professional. Then once you have all that information is power, right? Knowledge is power. And so we want to take that information and then create a plan for how we can treat that. When it comes to treatment, I always like to tell my patients that prevention is the best medicine. It's really difficult, or it's much harder to treat a miscarriage problem once you're already pregnant. If you haven't already healed your body before pregnancy, or if you haven't addressed the root cause and prepared your body for a healthy pregnancy. I'm not saying that it cannot be done, because I have done it many times. But the likelihood of being able to be of much more successful in preventing a miscarriage is to know the information in advance and then treat it ahead of time, before you are actually pregnant. And usually I recommend that you prepare your body for a healthy pregnancy for minimum 3 to 6 months based on what is the root cause of the problem. I'm talking in that time frame to be able to lay the foundations to give you the work for your long-term success. Ladies, remember that there is no shortcut to having a healthy baby. All these 10 days cleanse or 2 weeks juice fast, they cannot give you long-term results. There is so much more that goes into healing a woman's body and prepare it for a healthy pregnancy. So some of the key things that I ask my clients to do for prevention and preparing the body for a healthy pregnancy, the first one is diet. Diet is foundational. We always have to clean up the diet, and with a lot of these conditions, diet can impact a lot of these areas. Although diet is very important, it's not the only one. The second one is supplements, and I prefer nature-based supplements much more than synthetic hormones. I love botanicals, vitamins, minerals, food supplements, etc. Once we know what's off, whether autoimmune, blood clotting, whatever the problem might be, then oftentimes, not always, but oftentimes, with a combination of natural supplements, botanicals, vitamins, minerals, a good diet, lifestyle changes, we can make a huge difference in these conditions. And third, I have found bodywork and mind-body medicine to be tremendously beneficial for patients who have recurrent pregnancy loss, because there are so many mental and emotional blocks which are not letting you hold on to that pregnancy for 9 months, and we need to clean that up. Now, I'm not suggesting that you go out and just start taking any herbs and any supplements on your own. I do think when you have a condition of this severity with recurrent pregnancy loss, this kind of issue, there are a lot of nuances to it, and you do want to be under the care of an expert, somebody you want that guidance from. And you want them to be able to help you assess the situation, and create a plan for you and guide you through that process to navigate that journey that's extremely important. Oftentimes, once patients are pregnant, then the diet gets adjusted a little bit, the supplements get shifted a little bit, and also the body work and mind body peace also gets adjusted a little bit. So all of these things need to be reassessed once a positive pregnancy test has come about, and they may have to be changed several times along your journey. Lastly, I want you to know that you are not alone. The rate of miscarriages is really high. I have personally suffered from miscarriage in my mid-30s when I didn't know how to heal myself. Then by God's grace, I could heal my body to have a healthy baby in my 40s, and I have had the honor and privilege to help hundreds of women who had recurrent miscarriages to create the baby of their dreams, even if they had tried everything and even if they had tried IVFs and failed. So if you have had a miscarriage and you're willing to share your story with us, post your questions and check the link in the description box to book your virtual consultation with me. And for more information on how to believe your fertility and empower your body, please go to www.truehealing.com, truhealing.com. If you found this video useful, then show me some love with a thumbs up and subscribe to this channel. Please share this video with a girlfriend who needs to hear this so that this message can go out to more couples and women. Women are suffering and they are not getting the right information. Remember, you are awesome and you are fertile. Fertility is your birthright. Until I see you next time, take very good care of your fertility.